So I'm Dr. Brigatti with Orthopedics at Fort Worth Bone and Joint, and we were going to do a patient testimonial video with our patient Joel, who underwent simultaneous bilateral total knee replacement with myself and my partner, Dr. Brotherton.
Research and talk to people who've done one at a time. I thought I was physically able to do it, and I wanted to save time.
And then, what do you think were the advantages to you, other than it may just be the ones you already said?
Well, I've had knee scopes done one at a time. It takes time to recover, and the recovery is the same. So I figured by the time I did both knees at the same time, then the recovery would be some pain at the beginning, but then you'd walk the pain off, so I might as well do both at the same time.
You happy in the end you chose to do both at the same time?
I am, and so are some of my colleagues. They're jealous of the fact that I did them both at the same time.
How long ago was your surgery?
12 weeks.
12 weeks ago at this point. And I think I already said earlier, but who are your two surgeons?
Dr. Brigatti and Dr. Brotherton.
And then, what was your experience with them like?
Dr. Brigatti is classic about telling you what's going on and keeping you well informed, and the arrangement that he has outlined and your outline that you'll get as a patient are right on the money as far as your pills, what's necessary for home care, all of that. Dr. Brotherton, he was more of the secondary surgeon on this one, but excellent in the hospital, is well respected by the staff, and an excellent surgeon.
And then, did you feel like doing a two-surgeon team helped you recover a little better and faster?
I don't think that I could have done it another way without two surgeons, because you need one, there's some fatigue that goes on with that. They have a plan that's worked out. You know, one's opening the other leg when the other one's beginning to close, and it just worked out really well, tag teaming it like that. I was in surgery from 11 till 5. I went to the hospital, to the room in the hospital, and by 8 o'clock I was walking, and I've been walking ever since. So,
how long did you stay in the hospital?
I stayed overnight and was out the next day. I think the Dr. Brigatti said that I had to have, or you said, that I had to have to be able to pee and to walk. And so I met those criteria, and out I went.
Out you went. How long did it take you to get off of the pain medications?
I would like to say about 5 weeks. I was down to acetaminophen, and I don't take any pain medication today. I do have some soreness in the connective tissues, but nothing in the joint. It's surprising to me. I mean, I put up with this for 20 years, but it was surprising to me that there's no pain stepping up a step in the joint. There's no pain walking in the joint. But there are connective tissues issues that you've got to go deal with. So other than that, it's just, I'm doing well. I was on the walker probably the first week, and not because of instability, but because I didn't want my wife to worry about me falling down. So I used the walker only because I wanted to make sure that I didn't fall down. I'm still careful about making sure I don't fall down on my knees. And then I used a roll around for about 2 weeks, but I never took it out in public. And then I used a cane just for stability for about, off and on for about a week. So I would say within 3 weeks I wasn't using any assistance. So
how long until you could sleep comfortably?
You have to get used to where you're sitting in the recliner or whatever, so get a good recliner. But yeah, it was, I would probably say 5 weeks before I could lay in bed at night. And there's still a little discomfort, but it's only because you have pressure points on the inside and the outside. But at the end of 6 weeks, you're able to sleep in bed, maybe a pillow between your legs every so often. But there are pressure sensitive places, and Usually I would get up and go get in a recliner just so my wife could get some sleep because I'm moving my leg. But today I'm fine, so I just sleep like normal.
How long until you could drive again?
When does therapy start? Let's see, it starts the week after, so 2 weeks.
Impressive.
Number one, pay attention to the instructions that the Dr. Brotherton and Dr. Brigatti give you. They're right on the money. You'll start off with some heavy duty pain medication the first week, and then it tapers off to nothing. Follow that regimen for myself was good. The other thing is they'll tell you what to have in your home to make sure you're prepared for this surgery. And it's have a walker, maybe have a potty, have your toilet seat up higher, do those kind of things. Mostly because you're capable of doing things for yourself, but if in case you have to have some help, you know, you're older than I am or something, so if you have to have some help, they can help you get on the toilet or get those kind of things. But other than that, you're able to get out of the chair on your own. You're able to, you know, you have to have a little bit of assistance getting up. But within 3 weeks, I was motivating by myself, getting out of the chair by myself. You have to lift yourself up, let yourself down. But other than that, a couple of miracle incidences for me were 4 hours after I left surgery and the therapist had me up walking around the hospital floor. I was absolutely amazed that there was no pain in my joint. No grinding, and if you've had knee pain for a while, you get used to that pain, and then all of a sudden you recognize that there is no pain, and you just got a smooth movement on that. The other part of it is to find out how physically debilitating it is to walk on bad knees. So you walk on the outside of your feet, you're bow-legged, you take stocky steps like Herman Munster, and those kind of things. But the first instance when you start seeing that your feet work correctly, you wear your shoes correctly, you know, so you'll buy new shoes because you have to have new heels.
That's right.
So yeah, those are the things that happen that they're just, this surgery was, you know, I should have done it 15 years ago. I did the research, and so, you know, of course I looked at the character of my doctors, I looked at the character of the hospital, and then I looked at the character for the surgery, and Mako has a good web of information on that. And what was noted to me more than anything was in competitions against doctors and machine, the machine wins. And it's more accurate based off the CT scans they get. It's less physically disruptive to your bones. And I'm an engineer, so I like I like machines, and it just doesn't. It's superior. The robotic is superior, not to cut the doctor short, but it's just superior.